As the months of May and June comes, most of the children look forward to joining school, and then that is also corroborated with the onset of the Indian monsoon. Our childhood monsoons were very different. In Bangalore, monsoons, school-going children and the starting of school completely converges onto children becoming more sick. The reason for that is that with monsoon comes the advent of water transmissible diseases and also viral infections, because the temperature falling down as well as the humidity going up is a perfect storm for the viral infections to happen. In monsoon, however, we see two major problems in children. One is more incidence of infections, especially the respiratory tract infections. Second is a higher incidence of allergies. So how do we avoid these things in children during this monsoon season? So two major verticals is one, to prevent infection, we advise parents. First is because children are growing, moving and now confined into their homes, please wash their hands repeatedly. So maintain good hand hygiene. Number two, because the temperature has fallen, it is advisable to give them sips of warm water, which will keep the throat decongested and which will keep the airway moisturized. That will decongest the nose also, because children are compulsive nasal breathers. So warm water drinking also will reduce the symptoms of scratchy throat, cough and coryza. Third is that in older people we advise steam, but in younger children less than 8 years of age, steam can do more harm. And also children are not comfortable taking steam. So as a replacement of that, we advise them to do something known as hot wet towels. So just dip your small towel into hot water, wring the water, just wipe the face and squeeze the nose. Just do it for 20 seconds and the nose opens up and unclogs and the child feels much more comfortable breathing. So to prevent infections, regular hand hygiene, warm water to drink and hot wet towel. The common triggers for allergy, however, are dust, smoke and pet dander. So in the households in children where the chances of allergy is more or the child is more prone for allergic tendencies, we advise parents not to do dry mopping, not to do dusting. Please do only wet mopping or vacuuming and that will suffice. So to prevent these monsoon related maladies, especially the respiratory tract infections, and to prevent allergies and infections, hand hygiene, warm water to drink and also hot wet towel, as well as avoid dry mopping, only wet mopping or vacuuming in households. Thank you so much.